For those who love to spend more time outdoors during the summer, that's all well and good, but it can also lead to more injuries, sometimes even death. Emergency rooms see an 18% uptick between May and August across the country. ER physicians see everything from fractures to strain injuries, a whole lot more than that too. So Lee Summit Medical Director and orthopedic surgeon Dr. Matthew Daggett is here now with more on how to make a safe and injury-free rest of the summer. And you say really things get real busy heading towards fall.
Yeah, definitely. Fall sports are probably most, as far as an incidence of injury, the highest amount for youth sports that we see, mainly because of the sports that are involved, football, soccer, very high injury sports, and that's when we see a lot of our, as far as organized athletic injuries.
What would you say you see the most of?
Sports-wise or injury-wise?
Injury-wise.
Injury-wise, fall especially is a time where we see a lot of knee injuries, mainly because of the sports that are involved. Especially in football, we see a lot of injuries to like the ACL, the meniscus, things like that because of the nature of the sport. Also in soccer, we see that a fair amount as well. Summer, it's more of overuse injuries that we see. A lot of that kind of year-round baseball that's finally kind of coming to a little bit of a culmination. A lot of that wear and tear that's occurred in the youth sports, that's when we see a lot of that.
So let's talk about the exciting things that you're seeing and the treatments of some of these things, like an ACL tear.
Sure. So ACL reconstruction, historically, we like to think it has wonderful results. We like to think that our return to play is 100% and our re-rupture rate is 0. Unfortunately, our return to play, for example, in high school football, is 63% after an ACL injury.
Wow.
And our re-rupture rate, if you're younger than 18, that can be as high as 30% over a course of 15 years.
So you're almost guaranteed to do it again at some point.
Yeah, so our whole focus in our research is trying to figure out better ways to reconstruct that ligament when an injury does occur and better understand that injury to begin with.
And make it stronger.
Absolutely.
And so you're coming up with new ways of doing that.
Yeah, so we've definitely done a lot more research. There's one research entity called the anterior lateral ligament, which is a supporting structure on the outside of the knee that has been found to really contribute a lot to that rotational control of the knee that we historically have always thought about the ACL. For example, one of the studies that we recently were involved in found that women who have over twice chance of tearing their ACL have about a half the thickness of the ALL, or the anterior lateral ligament, as males do.
It's the tear.
Yeah, and to take that further, clinical results, our re-rupture rate with combined ACL and ALL reconstruction we recently published are 4% compared to traditionally around 10 to 20%. So, exciting stuff.
All right, one word of advice for parents getting their kids ready for fall sports, then what should they be doing?
Yeah, right now, really just make sure you're prepping, doing your injury prevention programs, also limiting your exposure to the specialized sports. We can't often prevent the acute traumatic injuries from occurring, but we really can focus and prevent the overuse injuries.
Overuse is key.
Absolutely,
all right,
overuse is key.
Thank you so much
pleasure.
for stopping by. Let's make it a nice, calm ease into fall. For more from HCA Midwest Health, go to kctv5.com. Click on Your Health under the News tab.